What I'm going to do right now is try and share with you the highlights of the data from this report that we put out. So Children First, for the last 10 years, every 2 years has been looking at the status of children. And since we started doing this 10 years ago, we thought this would be a good year to do a 10-year look back. Have things gotten better? What's gotten better? What's not moved? What's gotten worse? And we were pretty shocked by what we found. And to prepare this report, we spent a lot of time not just looking at data, but talking to decision makers, talking to policymakers, talking to parents, talking to kids, and talking to people who serve children directly. So the inputs into this report were really intended to make sure we get the story right. But part of the reason to be here today is to build this story with you and to also collectively work to change this. So I'm going to walk through this real fast. Everything I'm going to tell you is in the report that you have, so hopefully you don't feverishly think you need to take notes. And we'll also send out this PowerPoint. But I'm going to go through it quickly, and then what we're going to do is have some conversations with folks on the ground so that you can hear what some of this data actually means in action, so that it has much more meaning and it gives you the stories that we hope you will take with you when you leave and motivate you to take action with us in the year ahead. So the first thing, and the superintendent referred to this, what we did is we looked at what is the economic status of families. And one of the things that we know is that the census data kind of understates the challenges associated with income. It doesn't really capture how much it costs to raise children. And so we relied on a data analysis called ALICE, Asset Limited Income Households. And it's a data analysis that's put together by the United Way nationally. And what they found is that based on that data, 47% of families in Philadelphia are not earning enough to raise their children. And this is before anybody pays a dime of childcare. So if we add childcare to this mix, we're going to be closer to 60%. So people are making decisions like, do I pay my rent or do I get my kids as an inhaler? What do I do? These are real tough decisions that people are making. Jude, you probably saw this day one in your shop. Interestingly, in Philly, the amount of money that Alice says we need to earn for a family with 2 children and 2 parents is $74,000. And that sounds like a lot of money, but that is really a $37,000 a year job for each parent, or about 17 bucks an hour. So this is not a wealthy family, but this is how much it takes for families to make ends meet, and again, before childcare. So how many kids are in those families? 152,000. So if you've been to Wells Fargo, and you've been to Citizens Bank, and you combine all the seats there, that's how many kids who are being raised by parents who so wish they could do everything they need, like do a great birthday party at Chunky Cheese, but instead they have to make other decisions. It's a lot of children that we all have on our watch. Now this map, when we've done this report, we've done it in each of the counties, tends to show much more concentration in certain communities than others. But in Philadelphia, by and large, these children are everywhere. And it's really hard to see this map here, a little bit easier in your book. But the darker the area is, like the 80 to 100%, and again, the lighting is bad, we can see, and we live here. We know where these families live. We know where they're congregated, and it speaks to where do we make sure that we concentrate resources to accelerate their progress. One of the things that really struck us is we looked at family income, and we wondered, look, people's wages are going up. Yes, $7.25 is the minimum wage, but a lot of people are earning 10, 11 bucks an hour, maybe even 15. And so once we adjusted for inflation, we found that the situation is kind of bad. Like the bottom 20% of people in Philadelphia are earning less than $7,000 after you adjust it, or $7,200 once you adjust for inflation. Now, you can know that nobody can live on that, right? That's just not a viable experience. The next 20%, so now we're at 40% of Philadelphians. They're living on $25,000 a year, and their income has risen a little bit, $3,000 in effective spending power in 10 years. In effective spending power in 10 years. You can look up at the green line, that's the upper income, that's the top 20%, and their income's gone up about $22,000 in the last 10 years in terms of effective income. And this space between the green line and the yellow line is really something that challenges us to think about how do we make sure that families at the bottom, hardworking families, are getting some of the return of their effort, just as we're making that return possible through the tax code for people at the top. We'll talk a little bit about that. So we want to talk a little bit about, I mentioned childcare twice. 6 out of 10 families in Philadelphia who are eligible for childcare subsidy can't get in childcare subsidy programs because we have 2 challenges. One, there's not enough money to pay for childcare subsidy. And the second, we don't have enough workers in that system. Because to work in the childcare sector, you're going to earn 12, maybe you'd be lucky if you're 12 or 13 bucks an hour. Some childcare centers are now paying 15. But 15 bucks an hour is $30,000 a year. 40% of the people working in the childcare sector are on medical assistance and SNAP. And so they can go work at Costco, they can go work at Amazon and get more. And so kids are being shut out of childcare because of the structural problems in the system and the shortage of subsidy. And that means their parents are finding informal relationships if they're working, which means their work is less, they're gonna have problems going to work all the time, or they're not working, or they're not taking promotions. We hear over and over again, families who are on childcare subsidy rejecting earning more income because they'll lose their subsidy and they'll lose their ability to be at that childcare center because they'll need to go somewhere else. So it's a real problem. Families paying out of pocket for childcare are paying a quarter of their income for childcare. A quarter. And I'm sure a lot of you in this room are in that situation where you know you're shelling out an extraordinary amount of money for childcare. It's untenable for the working poor families who are just above the income level for child care subsidy. Families earning $36,000, $40,000 a year, and they're spending a quarter of that money on child care. So one of the things that happens when we don't invest sufficiently in child care is that we don't create a ladder that create an economic ladder that moves people up. So we're trying to look at what is the economic ladder that is able to move people up in Philly. And one of the things that is startling, but this has been true since the 1980s, we find it consistently, that some post-secondary education, not even a 2-year degree, not even a 4-year college, some post-secondary training, exposure, moves people up the economic ladder. So what you see here is that the green line shows that if you have some post-secondary training, of all the people with post-secondary training, only 18% are in poverty. Whereas without any post-secondary training, 23% will be in poverty. And without a high school degree, 35% will be in poverty. Now, of course, only 8% of people with a college degree are in poverty. But this is why the efforts to improve access to community college, post-secondary training, VOTEC training in high school, these are critical because we need kids to leave this school district, take some post-secondary training, and we will decrease the number of families in poverty significantly. And so, of course, college access is important, but we have incremental changes we can make that radically change the conditions for the next generation. Here's the sticker shock. Only 6% of kids in our school district are in VOTEC training in high school, career VOTEC. And let me tell you, the suburbs aren't much better. They're at 7%, 8%. Pennsylvania is behind the 8 ball. Every state around us has double-digit kids in VOTEC in high school. Double-digit. Delaware has 90% of their kids graduating with an associate's degree, an occupational certificate, or completed an apprenticeship. So their poverty rates are going to be lower than ours in the years ahead because they're changing their policies based on the data. We know that this school district suffered extraordinary cuts in 2011 and didn't rebound from those cuts until 2019. And thankfully, the governor, both Governor Wolf and Shapiro successively have proposed substantial increases. But our kids are suffering the shortage of resources with, these numbers are not surprising to anybody here. 65% of our kids are struggling passing the English assessments. 2/3, 3 out of 5 of the kids are struggling passing the math assessments. This is changing. As the superintendent said, we are the fastest improving school district in the country on the national assessments. But look, we got a long way to go. go. This is not an acceptable situation. And as more resources come in from the state, we've got to drive those resources into the classrooms. We have to reduce our class sizes in our elementary schools so kids get the fundamental support they need to build on the foundations of academics. This district is $1.25 billion underfunded. That is not Donna Cooper's analysis. That is the analysis that's in state law now, where they calculate the shortage of funding. And so we're very grateful to have Morgan Cephas here today because she is a fierce champion of fighting for these resources. We're very excited to have Councilwoman Landau come in today because City Council stepped to the plate last year at the mayor's request. We know this district needs more resources. We've got to close this gap. We've got to do it a lot faster than people in Harrisburg are thinking it can be done. One of the things that's draining resources from the school district is how much we're paying out to failing cyber schools. I hope you all saw that the Attorney General put out a report last weekend showing that cyber schools are both failing our students and sitting on more than $600 million of taxpayer dollars of just 5 of the 14 schools. Will be at about $1 billion that they're sitting on now. They're not spending, it's all their surplus. And the Philadelphia School District has had to shell out $214 million more to these failing schools. So families are choosing cyber schools for a variety of reasons, but the state is not doing its job making sure that those cyber schools are delivering a quality education and spending the money they are paid by school districts to educate children. This is a scandal, and when you think that a Republican Attorney General put out a report about cyber schools, you know that there is a shift in thinking about the corruption in this sector. So, one of the things we thought we'd show you is how far behind Philadelphia is compared to other school districts in the region in terms of what they're owed by the state of Pennsylvania. So you can see we're owed $6,326 per kid by the Commonwealth of Pennsylvania. And it may not surprise you that Chester Upland is owed a little bit more. We know the history of letting down the kids in the Chester Upland School District very much here. But Philadelphia and Chester Upland, and then you add Norristown to that, these are the places where there's the biggest debt owed, and these are the places where we need to advocate to close this gap. But we have a lot of company. There's a lot of people owed money by the Commonwealth of Pennsylvania. And we work actively in these communities to make sure their voices are heard, just like people in Philadelphia, on the resources they need. While every school district in the state I showed you, these school districts are owed money by the state, they also are getting increasingly diverse. This is the Philadelphia School District's change in student demographics in the last 10 years. And one of the things you can see is that we have about 8,000 more kids whose first language is Spanish than we had 10 years ago. And they're coming from lots of different cultures, but they're bringing lots of diversity and tremendous cultural capacity, but they also bring a language challenge for teachers. So we are increasingly diverse in our district, and we are struggling, like all districts, to figure out how to meet the needs of those students. They offer us a great learning opportunity, but they also offer us a great learning burden in terms of meeting their needs. The other thing we wanted to point out here, and this is another key issue about education, is that Philadelphia is the training ground for pretty much every suburban school district. You come to Philly, you start here, you learn everything you need to know, but you're only paying $45,000 when you start. So if you go out to any suburban district, you will earn more. Well, not any. A few of the low-level school districts pay like we do. But because of the state spending gap, if you are an extremely talented teacher and you have the opportunity to be hired in Lower Merion, what are you going to do? We expect people to stay here out of duty and mission. And thankfully, I'm looking at Jamie, thankfully people do stay here. But look, that's just no way to run a ship, right? We need to up what we're paying our teachers and be competitive. At the same time, Dr. Weddington talked about what's happening in terms of the health of our kids. After COVID, there were new rules in Medicaid, and thousands of children have been cut off from Medicaid as a result. So we have fewer kids in Medicaid now than we did during COVID, but even than we did in 2017 before COVID. And so these children are out there without health insurance. Thank God their school nurses in the Philadelphia School District ask them if they're insured, and those families can't get back on. So the big word that we need to spread is that the state needs to do a better job re-enrolling these children, because these they got a notice that they had to re-enroll, but people understood it as being cut off. And so this is a big challenge, and it plays out in what the district can do for its health services and its mental health services, because if kids aren't on Medicaid, we can't bill and support these kids. At the same time, the appointment of RFK Jr. presents an entirely new challenge for the Philadelphia School District. So every kid has to start school with a full battery of vaccinations. Fourfold increase in Philadelphia of kids starting school where their parents have opted out of mandatory vaccines. This is the story across the region. We have more and more parents who are buying the myth that vaccines are somehow going to cause permanent damage to their children. They then erode our herd immunity, and as a result, kids who are vaccinated are getting sick from the disease that they thought they were being vaccinated for. For instance, whooping cough. Pennsylvania now leads the country in whooping cough, a disease nearly eliminated. But when we get so many families choosing not to be vaccinated, even vaccinated kids get whooping cough. It's not as bad, but they get it. And this is just, it's a horrible, horrible thing to watch, and it's a horrible thing for us to be happening. You know, we're the lead people. We talk about lead everywhere we go. 56% of our kids are not being tested for lead. Now, Philadelphia leads the country in having the best lead ordinance in the country, making sure that every apartment is lead safe in order to have its rental license. Thank you to everybody who supported that. But we still need to test the kids, because it's going to take a long time to make sure we get lead out of the homes. And so this is a place where we work with health practices, we work with the state, but we encourage people to think about the fact that when kids are coming to school and they're having mental health struggles, it may in fact be lead poisoning that is at the root of their challenge. And so we've got to nip this in the bud. As the superintendent said, nearly half of our kids, when they self-report, say that they are sad, depressed, or anxious. And you know, it may be that the kids aren't telling the truth on this, but it's the same survey they've been taking forever. So if they were like overstating one year, they're overstating this year. You know what I mean? The data trend is really showing this is going up. And if you're a teacher in front of a classroom and you're trying to teach somebody who's feeling really blue or anxious, and then something happens and a student hits them the wrong way, and you know what we all do when we're cranky, okay, that's what's happening in classrooms, and it's a really hard place to teach, because we have far too many kids that are carrying way too much baggage from the trauma that they face and from the situations that they're living in. So that's about nearly 68,000 kids needing mental health services in the city. 68,000. And we have one mental health professional for every 290 people. Right? So we need to change this. We dramatically need to change this. So we have recommendations in here, and we're leading a new campaign called Strong Minds, Bright Futures, that will rapidly create create a mental health system that solves for that. And we encourage you to join that effort. So the good thing is that violent crime caused by kids has dropped by 51%. And we should note that the violent crime in Philadelphia always has been committed by adults. Our kids are not the reason we have high violent crime. They've typically been around 28% of all violent crimes, even in the height when we have highest years of gun violence. But fortunately, their engagement in violent crime is dropping. But we still have too many kids dying of gun violence. So this is all gun violence, wounds and fatalities. And you can see that the red is the fatalities, the blue is wounds, and that's all people. And this is from 2015 to now. But more than 1,000 of those deaths and injuries are associated with children under 18. So we obviously have much more to do to save our kids, and tackling gun violence is a critical piece of this. The good thing is that our kids are showing a decline in risky behavior. In the counties, actually, I have to tell you, this is dropping more rapidly than in Philadelphia. So they're smoking less, they're drinking less, they're using marijuana less, they're using vaping less. But at the same time, they're feeling anxious and depressed. And so what researchers are doing is kind of connecting the dots and saying, this might be a result of the fact that kids are spending more time on social media than they are with each other. And as a result, like lots of bad stuff, we know what doom scrolling's like, right? We're doing it every day since Donald Trump's been elected. They have their own doom scroll ranges. They're probably not doing Trump. But nevertheless, it's not good for their mental health. So they are exhibiting less risky behavior, but their mental capacity is eroding. Philadelphia's foster care system, I want to thank Kim Ali and Vanessa Garrett-Hartley for being here, doing a great job, taking fewer children out of their homes. We're really glad. It's a practice long overdue to be changed. So we're making great progress there. Thank you for making that change. And the city is doing more to keep families in their homes and support those families to be successful parents. And we have more data in the report about juvenile justice, about physical health, other physical health things. So this was just the highlights. We don't need to set the stage, but we wanted to also make sure that we make the connections with what's happening in Washington. So whether it's cutting the Department of Education, whether it's beginning to say that we need to cut Medicaid, whether it's cutting SNAP, all of that will make the lives of children worse. So we wanted to make sure that you knew that this is the congressional switchboard. You should take this picture, call it every morning, until they stop attacking the programs that harm our children. That's critical. We know that the state legislature will never succeed in doing the things that Donald Trump is doing. They will fight those things. But we need to make sure that our senators and our members of Congress know how important it is that we sustain the investment in kids.